Good morning, everyone. Continuing with the ABWM prep, just real quick, I'm trying to go over all these questions in the material, for the most part verbatim, and throwing in a little bit of clinical stuff every now and then, and trying to keep it short, so it's just a little bit of information each day. If you guys have a different idea or a different way you'd like me to present it, please let me know. Just text me on Slack so I know, and we can try to make it as productive as possible for you. But for now, just going to continue what we're doing. Wound healing environment again, anatomy and physiology. So, first question: describe the structure, function, and location of mast cells. Mast cells are the resident defense cells localized within tissues. There are two different types: the connective tissue type, which is localized in the skin, perivascular tissue, and the peritoneal cavity, and then mucosal type, which you're going to find in the gut and respiratory systems. They're characterized by extensive cytoplasm with large granules, which contain heparin, chondroitin sulfate, histamine, serotonin, echinosoids, and vasoactive proteins. Mast cells respond to tissue damage by releasing the contents of these granules, and this is responsible for immediate vasospasm and then subsequent vasodilation and leakiness of the vessels at the wound site, which will allow for white blood cells to enter the wound. Proteolytic enzymes are also found in the granules, which have a role in cellular recruitment and activation of endothelial cells. Activated endothelial cells express adhesion molecules and become sticky and ready for adherence of leukocytes. Activated neutrophils bind endothelium as well and will start to enter the wound usually within the first few hours after injury. There's two ways mast cells can be activated, either directly by pathogen binding or indirectly through receptor-mediated responses. So next question, define the role of leukocytes. So leukocyte infiltration characterizes the inflammatory phase of healing. So again, we've got hemostasis, inflammatory, proliferative, and then remodeling. So platelets are the first, and they secrete cytokines to recruit neutrophils or polymorph nuclear leukocytes, PMNs, as the first leukocytes on the scene. Their role is to kill microbes through phagocytosis and liposomal degradation. They basically sort of Pac-Man eat away the bacteria. And then the PMNs produce free radicals, echinosoids, prostaglandins, thromboxanes, and leukotrienes, and proteases that wreak havoc on the local tissue, causing pain, swelling, induration, all those kind of things that we typically say with inflammation. Also can be seen with infection. Now, leukocytes, especially the PMNs, typically only live about 2 to 3 days. So when they die, they form pus. If that pus is under the skin, it has to be drained. If it's on the wound, it may form exudate, infection, etc. What non-nucleated structure found in blood is involved in the clotting cascade? This is usually the first thing that actually starts wound healing, and this is the platelets. They're anuclear fragments of bone marrow derived from megakaryocytes. Under normal conditions, they numbered 150,000 to 400,000 per ml in circulating blood. Platelets normally circulate in the blood, but after endothelial injury or exposure to the extracellular matrix, components, they adhere to the vascular lesion, they recruit additional platelets and initiate the coagulation cascade, as well as signal all the other white blood cells to start healing process. Next question, explain the role of collagen and list the 5 most common types and their roles. So collagen is the main structural protein of the body. It provides tissues with integrity to facilitate tissue morphogenesis and platelet aggregation. It's essential for the epidermal adherence to the dermis. As we went over before, type 4 collagen is in that basement membrane that separates the epidermis from the dermis. The 5 major types of collagen are type 1, found in the skins, tendons, vascular, ligaments, organs, and bone. Type 2 is typically found in cartilage. Type 3, reticulate, is the main component of reticular fibers. Type 4, which I just said, is found in the basal lamina or the basement membrane, which separates the the epidermis from the dermis. And then type 5, which is found in cell surfaces, hair, and then the placenta. What protein in the body allows many tissues to resume their shape after being stretched? This is elastin. It's highly elastic connective tissue protein that assists many tissues in resuming their shape after being stretched or deformed. It also serves an important role in helping to distribute forces when bearing weight. So as patients get older, elastin typically decreases, which will increase the risk for skin tears, skin injury, etc. Where is the hypodermis and what function does it serve? So the hypodermis is subcutaneous tissue under the dermis. It's the innermost layer of the skin. It invaginates the dermis and is attached to it via collagen and elastic fibers. The primary function of the hypodermis are promote blood supply to the dermis, insulate the body, provide soft support between skin, muscle, and bone, promote skin mobility, mold body contours. Hair follicles are made up of what type of protein? The answer is keratin. What are the two types of hair follicle? There's vellus, which are light or fine hairs, and then terminal, which are dark or thick hairs. Define the location and function of sebaceous glands. A sebaceous gland is attached to each hair follicle, and these are typically found in the dermis, specifically in the reticular area of the dermis. This gland secretes an oily substance that drains into the canal of the hair follicle to reach the surface of the skin. So the function of the sebaceous gland is to produce sebum, and sebum serves to provide an acidic covering that supports and assists in maintaining a protective skin barrier. So stay tuned for episode 4. And like I said, any suggestions, I'm happy to take them. I basically want this to be something that's going to be helpful for everybody to get ready for this test. Okay, thanks. Take care.